We have clinical presentations here. We have on the one side we have diseases and others signs and symptoms. So we're gonna see parenchymal asbestosis. The signs and symptoms for this disease is insidious onset of dyspnea or exertion and fatigue. Secondly, we have asbestosis related pleural abnormalities. We don't usually have any signs and symptoms for this, but sometimes we have dyspnea, intermittent chest pain. Third, we have lung cancer. We don't see any signs and symptoms, but sometimes fatigue and weight loss or chest pain. On the fourth, we have mesothelioma. Also, we don't have any signs and symptoms for these, but sometimes we see some dyspnea, chest pain, and fatigue in some cases. Here we have exposure history, patient history. We're gonna see some data depending upon the patient history and medical history. So, exposure history and medical history. First of all, we're gonna discuss exposure history. The data is collected on the basis of work history, source, intensity, duration, and frequency of exposure, time elapsed since first exposure, workspace dust measurements, use of personal protective equipment, and some sorts of sources of environmental exposure. Medical history are some causes such as smoking and history of some other conditions like diseases, etc. So, physical examination, we're going to see how to physically examine such patients suffering from asbestos, lung cancer, or asbestos related diseases. So, first of all, we're going to have to focus on lungs, heart, digits, and extremities, and pulmonary oscillation to detect BBCLR, inspiratory rails. Observation of other signs such as clubbing of the fingers or cyanosis. In the physical examination, further on, we will see the pulmonary function test, how to see if the pulmonary is functioning or not, pulmonary veins. So, for diseases, we have parenchymal asbestosis. So, we see reduction in FVC, normal FEV1 FVC ratio, reduction in FEF, 25 to 75% of reduction in FEF. And asbestos related pleural abnormalities, these are often normal, and reduced FVC can be associated with diffuse pleural thickening. And according to the lab extremities, we have chest radiograph findings, parenchymal asbestosis. These are small, irregular oval opacities, interstitial fibrosis, shaggy heart sign, and pleural plaques, areas of pleural thickening, sometimes with the calcification, pleural effusion, diffuse pleural thickening that is associated with lobulated prominence of pleura adjacent to thoracic margin, and interlobar tissue thickening. On the other hand, we have rounded atelectasis, rounded pleural mass, bands of lung tissue radiating outwards. So that means the mass is growing. Same findings as those of the other lung cancer etiologies. So chest finding of mesothelioma, these are associated with the pleural effusions, pleural mass, diffuse pleural thickening. Some tests are performed such as CT, HRCT, BAL, lung biopsy, ABG, pulse oximetry, colon cancer screening. That's all for now. I hope you liked the video. Please like and subscribe, and see you in the next video. Thank you. Have a good day.